of Kavir TV and Radio for joining us today. I just did a program in Persian for the Persian-speaking followers of the program. I was also asked to give a brief English equivalent to the same presentation. Today is April 7th, 2020, and I'm giving an update on the coronavirus pandemic as far as the latest information. The exponential growth of the disease and its spread in the US continues. In most of the world, it continues to the same effect. Within the US, the state of New York is most significantly affected. However, every state seems to be following an exponential curve at this point. A lot of very significant social and physical distancing measures have been put in place. Many states have lockdowns and stay-at-home orders. Some states have some quarantine orders, but certain non-essential businesses are still allowed to continue to function in a limited fashion. Most non-essential work has been stopped, and a lot of work that can be done from home continues to the same effect. All of these measures are taken in hopes of flattening the curve and slowing down the exponential growth to a level where it becomes manageable to take care of the most critically ill who may go to hospitals and require ICU care with ventilation and intubation. Quick historic note is Avicenna, a Persian scientist and scholar who lived about 1,000 years ago, had suspected that certain secretions from bodies of certain patients may have disease agents within them. He didn't use the word microbe, but he said that there are disease agents within them in his book, Canon, that may transmit through human contact. And one of the things that he promoted was that the patients who are affected need to be isolated. And this isolation, he used the word al-arba'ina, which means the 40 for it, which meant that these patients were to be isolated from the rest of the population for 40 days, because he had surmised that the disease process would take probably 40 days to run its course for most patients. When such terminology and when Canon, the book, came to Italy, quarantena, which is 40 in Italy, was actually used for the same process. So the word quarantine, as we use it in English today, is really a continuation of the same process that about 1,000 years ago was instituted by the Persian scientist and scholar Avicenna, philosopher as well. I would like to give an update on some of the therapy modalities that are being worked on. First is the use of plasma. The use of plasma from patients who have recovered from the disease has started to occur in the US in some academic centers. Most hospitals do not have access to this potentially life-saving measure. The initial data seems very promising in helping the most critically ill. The unfortunate thing is supply. This is something that can only be obtained by drawing the blood and separating the plasma of patients who have experienced COVID disease themselves and have recovered from it. And their plasma now contains antibodies that can help fight the virus in another patient who is having a difficulty and a critical situation with the patient. And unfortunately, we have a supply issue with it. As more and more Americans end up recovering, and their plasma can be made available as long as it's tested against certain disease agents and certain other antibodies against which other patients may have serum sickness. This is a reasonable modality to take care of the most critically ill. The story of hydroxychloroquine in combination with clarithromycin or azithromycin continues. It has been somewhat politicized. The big issue is this. What we know in the laboratory is that coronaviruses generally can be attenuated or weakened by the use of hydroxychloroquine. So viral activity can decrease with this medicine. In vivo, which means in patients, the data is very sparse. There are small studies that show no difference, and then there are some small studies that show a difference. Much larger trials are being performed currently and are underway to try to get a final answer to this. The only thing that I can say is that hydroxychloroquine, which is the malaria drug everybody's talking about, is not a cure for COVID-19. At most, all it is that it is a measure of decreasing mortality of this patient, of this disease, and there may even be a use in prevention for this, for the use of this medication against the disease, but all of that remains to be seen. It is not a panacea, it is not a cure, but at best it may either help decrease the transmission or help decrease the mortality rate from the virus itself. Moving on to ivermectin, that is an anti-parasitic drug. There's a study now coming out of Australia that is underway that this anti-parasite medication may have utilization and antiviral activity against the coronavirus, the novel coronavirus. And so that remains to be seen. And the work continues on performing large trials with 2 anti-HIV medications, as well as an anti-Ebola medicine. None of them have a definitive answer, but we know that there is some early promise in some of them, and that's why we're trying to define it scientifically to see if in populations they're safe to be used for this purpose and if the patient's mortality decreases. The vaccine story continues to evolve. There are multiple different companies in conjunction with governments that are working to develop the vaccine. There's an S1 subunit on the surface of the virus. It's a glycoprotein on the surface of the virus that seems to be somewhat unchanged as the different versions of this virus and little mutations within the virus are studied, and it appears to be highly immunogenic. So a recombinant protein has been made in the laboratory that looks like that S1 subunit, which is the site where the virus goes to attack with against the ACE2 receptors within the human body. And so given that it's highly immunogenic, meaning that when you put this recombinant protein in the form of a vaccination in patients, they tend to develop immunity to it. It will remain to be seen that if they get challenged with the virus, whether they will actually have immunity against the virus. So that process is continuing. A vaccine that is widely available is still likely many months to a year away. However, the research continues at a very rapid pace with it. There's also monoclonal antibodies against IL-6. IL-6 is one of the inflammatory mediators that is released within the body to fight infection, but sometimes when that inflammatory mediator ends up setting into motion a cytokine storm, which is kind of an inflammatory storm within the body, that by itself can increase the mortality. And so the use of this particular antibody against IL-6, which is a function of our own immune system, may help give patients a few more days to try to fight in a more controlled situation. So that has shown also some promise in patients. Also, patients in whom cytokine storm or this kind of massive inflammatory reaction is suspected may benefit from the use of steroids in trying to calm down the immune system while the body continues to fight the good fight against the virus. I also wanted to talk a little bit about the social consequences of the current pandemic. There are economic and social issues at hand. The economic issues are that people's income, some of them have completely lost their income, and some individuals have had significant diminishing of their earnings. At the same time, they are spending inordinate amount of time together with the rest of their family. which is not something that they're used to. And so being together within the same household without a lot of outlet, without a lot of opportunity to leave the house, increases the tension within the house, and it has increased the rate of spousal domestic violence, violence against the elderly who may live in the same household, and against children as well. So it's very important to be mindful that these are very extraordinary emergency situations that the governments are helping very significantly to try to provide as much relief as possible. And we all hope to emerge from this in the best possible manner. And so finding ways to, even within homes, perhaps distancing from each other, trying to find ways to not engage in petty conversation and identifying them, and trying to have a very forgiving and understanding attitude during this time will be very useful. There are safe houses and women's shelters currently that are also overrun with demand, and that is not an ideal situation either, with quarantining people and with trying to keep the social distance. So this is very important to just be mindful of as best as possible to avoid conflict within the home. There's also a question about whether the summer is going to help us. We don't know. That's the answer, because this is a new virus and we do not know how it behaves. But if it behaves like other respiratory viruses due to several changes that occur with change of seasons, we think that the virus would also have decreased activity. That is not to say that it completely packs its bags and goes on a summer vacation, but its activity will be decreased. Much like it's possible to get the flu in June, it's just far less common. The issue is, would this virus behave the same way? We don't know, but we think that if the number of existing active cases are as minimum as possible, the chances of the weather helping would be higher. But if we're at an epicenter with a hot spot of viral activity in our community, that will act like an inferno against which a light rain, which would be the change of season, would likely have very minimal effect. And so I would caution that we cannot just take a very laissez-faire approach to this and be very complacent about it. All of the instructions about hand washing, distancing, and social distancing particularly, as well as wearing masks like cloth masks when we are in public, especially in enclosed places, will help decrease the overall burden of virus in our population. And hopefully, given all of that, with a flattening of the curve, the summer months may be useful to us as well. I spoke a little bit about the wearing of the mask. I'm not sure if I addressed this earlier, but the CDC did recommend that homemade masks such as cloth masks or even scarves would be useful, especially if people are within close proximity. The understanding is that even though this virus is mainly transmitted by contact to another human being or to surfaces that may be contaminated, or through droplets such as coughing and sneezing, we think that there's a certain number of viral particles that are released into the air just through simple talking or singing that will form kind of an aerosol cloud that is somewhat space limited. And the virus can float in the air for up to 3 hours, although we think that its clinical activity is probably less than that. And so it's most important for patients or for individuals to cover, because when they cover, the size of that aerosol cloud around them gets smaller and the chances of transmission will get less. And if you were to try to have, let's say, a tight scarf wrapped around your nose and your mouth and try to blow out a candle, you'll see how hard it is to do that. And so the idea is that the virus would be, if we happen to be sick and be asymptomatic, the virus tends to not be spread around us to people around us as much as possible if we actually cover up. There is even a theory that in places like Asia, such as China and South Korea, that instituted mask wearing quickly, they tended to have a better, faster flattening of the curve. And so we think that this may be part of the puzzle, but certainly is not a replacement for giving people the moral hazard of thinking that they're safe because they have a mask and then get closer to other people or forego hand washing or doing things that you're still supposed to do. Thank you very much to Radio Kavir and Kavir TV for putting this program together. I am Dr. Missaghi. I'm an anesthesiologist in the Phoenix area, and I'm happy to be of assistance to anybody who wanted to have an update about coronavirus. Be safe and be healthy.